The liver is an organ about the size of a football. It sits just under your rib cage on the right side of your abdomen. It is important for digestion of food and getting rid of toxic substances in the body. It can be inherited liver disease or genetic. Liver problems can be caused by a variety of factors such as viruses, alcohol, and obesity. Hepatitis B is a serious liver disease caused by the hepatitis B virus. In some patients, it becomes chronic, meaning it lasts more than 6 months. Having hepatitis B also increases your risk of liver failure, cancer, or cirrhosis, which is a hardening and scarring of the liver. 90% of adults with hepatitis B recover fully. Infants and children, however, are more likely to develop chronic, long-lasting hepatitis B. A vaccine can prevent hepatitis B, but there's no cure once you've contracted the disease. If you're infected, taking certain precautions will help prevent the spread of the virus. What are the signs and symptoms? They may be from mild to severe, appearing 1 to 4 months after you've been infected. Some people, usually young children, may not have any symptoms at all. The symptoms include pain in the abdomen, dark urine, fever, joint pain, loss of appetite, nausea, vomiting, weakness and fatigue are important, yellow eyes, yellow skin. When do you have to see a doctor? If you know that you've been exposed to hepatitis B, you go see a doctor. Preventive treatment given by the doctor may reduce the chance of infection if given within 24 hours of exposure. If you think you have some of the signs and symptoms mentioned, go see your doctor. Hepatitis B infection is caused by the hepatitis B virus. That virus is passed from person to person through blood, semen, or other body fluids. It does not spread by sneezing or coughing. Now, what are the common ways it can spread? Sexual contact. If you've had unprotected sex with someone who is hepatitis B positive. If you share needles, hepatitis B virus spreads easily through contaminated needles, contaminated with hepatitis B blood, right? Now, accidental needle stick injury. If you're a hospital worker who has had an accidental needle stick injury from someone who is hepatitis B positive, then your chance of contracting it is high. Mother to child used to be the most important mode of transmission from mother to child, when a positive mother can transmit it to a newborn. But once the newborn is vaccinated, the chances are much less, all right? Now, acute versus chronic hepatitis B. Hepatitis B infection is often acute and rarely, in fact, chronic. Acute hepatitis B infection lasts less than 6 months and you will most probably clear the virus from your body, right? Now, most of you who get acute hepatitis B get it as adults. Now, when do you get chronic infection? Chronic hepatitis B infection is a virus that's not cleared and lasts more than 6 months in your body, all right? And hepatitis B, chronic hepatitis B may lead to cirrhosis and liver cancer and last a lifetime. Newborns less than 5 have a higher risk of having chronic hepatitis B if they contract the infection. What are the complications of hepatitis B? Now, having a chronic hepatitis B infection can lead to serious complications. Cirrhosis or scarring of the liver was one of the most feared complications, and this may impair the liver's ability to function. Liver cancer, of course, is the most feared complication of chronic hepatitis B. Liver failure is when the liver function shuts down completely and a liver transplant is needed to sustain life. That is another feared complication. How do you prevent hepatitis B? Now, the hepatitis B vaccine is what prevents it, and you get 3 injections over 6 months. You can't get hepatitis B from the vaccine, don't worry. Hepatitis B vaccine is now compulsory for all newborns in Malaysia and children and adolescents. All right, so make sure your children are vaccinated, make sure that you are vaccinated. Healthcare workers, emergency workers in hospitals, they must be vaccinated. Anyone who has a sexually transmitted infection must be vaccinated. Those who share illegal drugs or needles or syringes, those with chronic liver disease, those with kidney disease, all should have the hepatitis B vaccine. Prevention will include being cautious about body piercing and tattooing as well, because these are methods where you can contract hepatitis B and hepatitis C. So be very careful about tattoos, because hepatitis B and C can be transmitted through tattoos and unclean needles. How does your doctor diagnose hepatitis B? He or she will look for signs of liver damage, yellow eyes, distended belly, right? And he will conduct blood tests that detect the hepatitis B virus in your body or suggest that it might be in your body. In other words, if the liver function tests are abnormal, that may suggest hepatitis. He may do an ultrasound of the liver to see whether your liver is damaged. And very rarely, he may take a little bit of tissue from the liver, a liver biopsy, to see how badly your liver has been affected by hepatitis B or C for that matter. Screening healthy people for hepatitis B in Malaysia, I think, is useful. I think it's useful because it's quite a common viral infection of the liver in Malaysia. So talk to your doctor about screening for hepatitis B, especially if you're pregnant, you live with someone who has hepatitis B, you've had many sexual partners or had relations with someone who's got hepatitis B, or have a history of sexually transmitted illness, or if you're HIV or hepatitis C positive, then it's worth testing for hepatitis B. Anybody with unexplained abnormal liver function tests should be screened for it. Dialysis patients should be screened for it. People going for transplants should be screened for Hep B. If you're a drug abuser, you're a prisoner, these are people who should be screened for hepatitis B. Everyone wants to know how to treat hepatitis B. If you know you've been exposed to the virus, the hepatitis B virus, say you've had a needle stick injury, and you're not sure if you've been vaccinated, call your doctor immediately, because an injection of a certain antibody given within 12 hours of exposure to the virus may help prevent the infection. This is a rare instance, but it is something you should know about. You should also receive the hepatitis B vaccine at the same time. Now, if you have acute hepatitis B diagnosed by the doctor, meaning it's short-lived hepatitis B, you may not need any treatment because 90% of the time you will recover. Now, if you have severe acute hepatitis B, you may need antiviral drugs. The main issue of treatment is in chronic hepatitis B, those who have had it for more than 6 months, because treating these patients helps to reduce the risk of liver disease, cirrhosis, and cancer. We have very good antiviral medications which are taken by tablet, orally. You would have heard of entecavir, tenofovir, lamivudine, adefovir, telbivudine. These are all drugs that can be used to treat hepatitis B and reduce your risk of progression to chronic liver disease. These are drugs that are available in hospitals and with private care practitioners as well. So these are readily available drugs which are very easy to take with very few side effects. So if you need treatment, if the doctor determines that you need treatment, then you should get the treatment. Not everybody with chronic hepatitis B needs treatment, but those who need must get the drugs. Now, if your liver has failed, it's not functioning at all, then you may need a liver transplant where the surgeon removes the bad liver and replaces it with a healthy liver. Many new drugs to treat hepatitis B are being developed, all right? So the future is bright. Now, if you've been infected with hepatitis B, make sure you protect others from the virus. Safe sex is always recommended for those who have hepatitis B. Your partners also need to know your hepatitis B status and their hepatitis B status as well, so that you do not transmit the infection. If you have hepatitis B, don't share needles, syringes, razor blades, or toothbrushes if you are hepatitis B positive, because you can transmit the infection.
It is very important to take your medications exactly as prescribed by your doctor. This means taking it at the right dose, the right time, the right frequency, the right duration, and in the right way. If you are taking an antiviral, you should continue to take it according to your doctor's instructions, even if you are feeling well. Do not stop taking it without first discussing it with your doctor. If you stop taking for a while or skip some doses, there's an increased chance that the virus will become resistant and that the infection will get more difficult to treat. Another important consideration is what time to take your medication. Some medications are more effective if taken at certain times of the day. Certain drugs work better if you take it before food when the stomach is empty. On the other hand, there are other drugs where the absorption is better if you take it after a meal. If you are unsure of how to take your medication properly, you can always speak to your doctor or your pharmacist. Drug interactions are something to be considered if you are taking 2 or more medications at the same time. Some medications do not mix well with one another. This also includes supplements and your traditional medication. Taking them simultaneously may sometimes cause one or more of the drugs to be less effective, or in some cases lead to an increased risk of harm and side effects. There might need to be changes to the timing you take the interacting medications, the dose of the interacting medications, or in some instances, a different drug may need to be chosen altogether. Whenever you are consulting with any healthcare professional, it is therefore very important to let them know what regular medications you are taking. One way of doing this is to keep a list of your usual drugs with you, for example in your wallet or electronically in your mobile phone. You can also bring along your medications whenever you visit a doctor at his or her clinic. This will help the doctor or pharmacist to, if necessary, select the right medication to treat your condition without causing any interactions with your existing drug therapy. Just like for fatty liver, your first go-to resource for any queries on hepatitis B and C should be your physician or pharmacist. To know more about your medication, you can also refer to the official product insert usually supplied with your drugs, or a reliable reference such as MIMS, Medline, or Medscape, which can be accessed online.